Hello, I'm Sami Alani. I'm the lead for anatomy at Aston Medical School. In this video, I will talk about how anatomy is taught to medical students at our medical school. You'll be pleased to know that we only teach you human anatomy, and we try our best to only teach you and test you on anatomy that is clinically relevant. In year 1 and 2, there are anatomy heavy blocks. In term 1, teaching period 1, you will start with fundamentals of body structure, which is FBS. And this is basically a gentle introduction to anatomy. And then in teaching period 2, after the Christmas break, you will start MSK, which is the musculoskeletal system. In year 2, you'll have 2 anatomy blocks, the nervous system and neuropsychiatry, and the head and neck block. Anatomy is also taught in other sort of non-anatomy blocks, if you like. In year 1, there is the cardiovascular system block, and in year 2, it's taught in the respiratory, reproductive, gastrointestinal, and also in the renal and urinary system blocks. Anatomy is taught in these anatomy blocks with 2 lectures each week and 2 hours of adapted team-based learning. The tutorials are based on the previous week's lectures, but as there is a lot of material to cover, tutorials often introduce new material and don't necessarily cover exactly the same material. This is why we encourage you to attend the lectures and the tutorials each week. So how will you learn anatomy? We can teach you, but we can't learn it for you. We provide you with lectures and tutorials, but ultimately it's up to you to learn. You will need to discover your own way, but as adult learners, we do expect you to prepare for the sessions. So this includes doing the required pre-work. And it's always a good idea to at least have a look at the questions in the workbook for the upcoming small group tutorials that you have each week. We don't expect you to do them all on your own, because that wouldn't be team-based learning. And we do expect you to attend all the sessions. In these team-based learning tutorials, you will be answering questions in your workbook, and trying to work out the answer is often more important than actually finding the right answer. So what do I mean by this? The learning is often in the working out of the answers. A bit like your teacher's telling you to show you're working out and giving you marks for it. As this old proverb suggests, we don't want to just give you the answer or the fish, but we want you to learn the skills of solving problems and also to learn how to access information and learn how to assess if it is reliable. Basically, then you can go away and catch your own fish. You will work in small groups using available resources. Please interact with these resources. You will learn to collaborate with colleagues and use teamwork to solve questions and problems. Most of these are based on real clinical scenarios, so very similar to what you'll be doing as a modern doctor. Sometimes you will also get to meet real or expert patients, as we call them, and you can speak to them and find out more about their condition and how this affects their lives. One way of visualizing structures that are inside the body is to use clinical imaging. So many of you would have had x-rays, for example, an x-ray of your chest or of a bone to see if it's broken or fractured. We introduce clinical imaging to you from the beginning of your anatomy course. In your worksheets and tutorials and lectures, you will see images similar to the ones shown here, taken using x-rays, like the one at the top right-hand corner. That's an x-ray of a hand, or CT scans, or MRI scans, or nuclear medicine studies. Also ultrasound, the bottom right-hand corner, there's an ultrasound machine, similar to ones that we have at Aston Medical School. The idea is to help you to learn what is normal and abnormal anatomy, and also what is normal and abnormal imaging as well. And it's also a gradual introduction for you to learn how to interpret clinical images, which you'll do more of in your clinical stages. And of course, these are very important skills in practicing as a doctor. Another way to see inside the body is to use endoscopy. This is an instrument that is equipped with a camera, and it's inserted either through a natural orifice or via an incision in the body wall. Again, you will be introduced to endoscopy images from the beginning of your anatomy course. This will help you to learn normal anatomy, like this image of the lining of the stomach. That's normal lining of stomach shown there, but also to learn abnormal anatomy and pathology. You will have clinical teaching fellows to act as your guides and facilitators in this process. Also, quite regularly, we get you to present and teach a topic to each other. Not only will you learn presenting skills, but one of the best ways to learn is to teach. Realistically, though, most of the anatomy learning you will do by yourself, and that's how most of us have done it. It's self-directed, you do this before and after the sessions and in revision times and so on. If you don't get to complete all the questions in your worksheets, please do consider them as self-directed learning or exam practice and do them in your own time. A question we often get asked is, do I need to know this or that for my exams? Trying to figure out what you need to know is difficult, particularly at the start of the course, but it does get easier. Please use the learning outcomes, the workbooks and lectures to help determine what you need to know and gauge the appropriate level of study. That's not to say we don't encourage you to do background reading, quite the opposite, but obviously you need to know a lot of the core material to get through the course and the exams. Also, you will have practice tests and quizzes, so you can test your knowledge and learning as you go along to help confirm that you are on track. I do like this quote. Generally, my advice is to get away from the goal of just passing exams, but rather start to ask yourself, will knowing this material make me a better doctor? So in this video, I have spoken about how anatomy is taught to medical students at Aston Medical School. Hope to see you soon, and thank you.